Okay, today class is on the lungs. So first we'll look into lungs. So lungs comes under the part of the respiratory system. So this, if you look, see in during the life, the right and left lungs are soft and spongy and very elastic. When you look into the in the child, they are pink, but with age they become darker and molted because of the inhalation of the dust particles. So in this the lungs come under the system called as a respiratory system. Then the lungs are covered by a pleura. You have seen the pleura, right? Or imagine it into plural side. Because of the negative intrapleural pressure, the parietal and visceral pleura can slide over each other during respiration. So this is about the lung, the features you see. Then there are therefore separated from each other by heart and great vessel and other structure in the mediastinum. So the right and the left lung are separated from each other by heart, the great vessel, and you see the structures in the mediastinum. Each lung is covered with visceral pleura. There are two layers of the pleura. We have seen that one is called as parietal pleura and one more is visceral pleura. So each lung is covered with visceral pleura and suspended free in its own pleural cavity, being attached to the mediastinum only by its root. So see, you can look into the two lung. You can see here the right and the left lung. These are the two lung you are seeing, right lung and the left lung. Okay, so when you come to the shape of the lung, if you look, each lung has a blunt apex which project upward into the neck for about 1 in. A concave base that sits on the diaphragm. You see the concave base which will sit on the diaphragm. A convex coastal surface which correspond to concave chest wall and concave mediastinal surface which is molded to the pericardium and other mediastinal structure. So, at about the middle of this surface is the hilum, a depression in which the bronchi, vessel, and nerves that form the root and enter and leave the lung. So, remember what do you mean by the word hilum? A hilum, a depression in which the structures will enter and leave the lung. So, you see structure which is entering and leaving the lung. So, you can see bronchi, vessels, and nerves, and that form the root and enter and leave the lung. So see, this is see the shape of the lung. You can make out clearly. It has got a apex, a base. You see the apex and the base. See the base. The base is resting on the diaphragm. You can see a pointed part that is called as the apex of the lung. And this is a part region you see hilum, where you see structures enter and leave the lung. Okay, then there are borders. The anterior border is thin and overlaps the heart. The posterior border is thick and lies beside the vertebral column. Okay, then we look into the first about there are two lungs. The two lungs are called as the right lung and the left lung. So we look into detail about the right lung. The right lung is slightly larger than the left and is divided by oblique and horizontal fissure into three lobes. The three lobes are upper, middle, and the lower lobes. So if you see here, see these are when you look, if I tell you the external features of the lung, you can clearly see here. See each lung, see this is each lung present an apex, a base, and three borders and three surfaces. There are three borders and three surfaces. Then if you see apex of the lung, see this is the apex. The apex of the lung extends into root of the neck about 2.5 centimeter above the middle end of the clavicle. Apex is covered by cervical pleura and external by suprapleural membrane. So this is the apex, okay, which lies, only remember, the apex of the lung extend into root of neck about 2.5 centimeter above the middle end of the clavicle. It lies about 2.5 centimeter above the middle end of the clavicle. Then comes the base. If you look, this is a base. The base is concave and rests on the upper surface of the diaphragm. The diaphragm is below, so it rests on the diaphragm. The diaphragm separates the base of the right lung and from the right lobe of the liver. Left lung, the right lung is separated from diaphragm by the right lobe of liver. Then the left lung from the left lobar liver, fundus of the stomach and spleen. Okay, the base is covered by diaphragm. The base is separated from the diaphragm by presence of pleura, that is called diaphragmatic pleura. You have seen diaphragmatic pleura. Then comes this surface. This is called as a costal surface. So look, the costal surface is related. It is related to ribs. Okay, ribs and the ribs which consist of ribs and the intercostal spaces. See, and here you see impression. Okay, so the and present impression of ribs and costal cartilage. It is covered by the pleura. Which pleura? The costal pleura and the fascia there called as the endothoracic fascia. Next is the medial surface is divided in anterior mediastinal part and the posterior vertebral part. Next is the vertebral part is related to bodies of the thoracic vertebra, intervertebral disc between them. Then the mediastinal part is related to mediastinum. It presents hilum of the lung, cardiac impression. So next if you look here, you can see this is a right lung and this is a left lung. There are two lungs, the right and the left lung. So the right lung is divided into three lobes by two fissures. The two fissures are called as one is called as a horizontal fissure and one more is called oblique fissure. So right lung is divided into three lobes by two fissure. One is horizontal fissure and one more is oblique fissure. So the lobes are named as upper lobe. Okay, you can name it as upper lobe, superior, middle and the inferior lobe, whereas the left lung is divided by oblique fissure into upper superior and the inferior lobe. So remember, right will have three lobes, left will have two lobes. See here, oblique fissure. The oblique fissure runs from the inferior border upward and backward across the medial and costal surface until it cuts the posterior border about 2.5 cm below the apex. Then comes the horizontal fissure, runs horizontally across the costal surface at the level of fourth costal cartilage to meet the oblique fissure in the mid-axillary line. So just remember the two fissures there. One is called as oblique fissure and one more is called as a horizontal fissure. Now, the left lung, we have seen that it has got only one fissure, that is called oblique fissure, which will divide into upper and lower lobe. So there is no horizontal fissure in the left lung. Okay, so you can make out clearly. See here, right lung and the left lung. How I know? Right will have three lobes, left will have two lobes. Then, next we are coming into the part that is called as the mediastinal surface of the right lung. So, what are the features you see in the mediastinal surface of the right and the left lung? So, see in the diagram here. See, this is the surface what you are looking here. So, this is a See this, if you look at this is the apex of the lung, this is the base of the lung. So the view which you are looking, the view, this is called as the mediastinal surface view you are looking. So it is called a mediastinal surface of the right lung. So in this surface you see some impressions. Okay, so what all the features you see in the right lung you can make out here. They are called as first one, cardiac impression. You see here, cardiac impression of the right atrium, groove for the superior vena cava, groove for the inferior vena cava, then arch of azygous vein, here arch of azygous vein, then come esophagus and trachea, the nerve related, right vagus nerve, right phrenic nerve and the ascending aorta and the thymus. These are all the impression or the mediastinal surface of right lung. So see, this diagram you have to practice. So I'll tell you how to draw. See, first you draw the right lung. Okay. Then the next you have to use a relevant color. Next you drew the hilum. This is the part called the hilum. This is a hilum. Remember to draw the hilum. This is a hilum you draw. Okay. Then after the hilum is drawn, you can draw next this part. That is called as a superior vena cava. So draw the superior vena cava. This is a superior vena cava. Right below it here, you draw one more, that is called as the inferior vena cava. So two vena cava, superior vena cava, inferior vena cava. Then here you can see the makeout in this way, arch, that is called as the arch of azygous vein. Arch of azygous vein. Behind it you can see this part, that is called a trachea. Behind it you are seeing this one is called as the esophagus. Trachea and esophagus. After that, in the groove you can see here the nerve running, that is called as a right phrenic nerve. And here the nerve running is called as a, in the trachea, what the nerve you are seeing, that is called as a right vagus nerve. So these are all the mediastinal surface features you are looking. So I'll repeat it again for you. So what all you see, first is draw the diagram. You can see first mention about superior vena cava, inferior vena cava, arch of azygous vein. Next you draw trachea, esophagus. Above the trachea you draw the nerve, vagus nerve. Then the nerve running here, it is called as a phrenic nerve. Okay, these are the features you have to mention. Next, after that you have to draw about the hilum. Hilum is where the structures will enter and leave the lung. So in the hilum, see, the first thing you have to draw the two pulmonary, superior pulmonary vein, inferior pulmonary vein. Then behind the superior is the pulmonary artery. Then there are two bronchus here, that is called eparterial bronchus and hyparterial bronchus. So these are the two, eparterial and hyparterial bronchus. These are the structure. Vena cava, this is superior pulmonary vein, inferior pulmonary vein, pulmonary artery, and these are eparterial and hyparterial bronchus. These are the features you see in the right lung, hilum, hilar structure of right lung. Okay, now next we look into the mediastinal surface of the left lung. So the mediastinal surface of the left lung consists of cardiac impression related to left ventricle. Here the cardiac impression related to left ventricle. Then comes the arch of aorta. Arch of aorta will continue further as a descending thoracic aorta. Then you see branches of arch of aorta here, they call as left common carotid artery, left subclavian artery. Then after that you see the esophagus, then the thoracic duct, left vagus, left phrenic, pulmonary trunk and the thymus. So these are the features you see on the mediastinal surface of the left lung. Cardiac impression related to left ventricle, arch of aorta, descending thoracic aorta, branches of arch of aorta looking left common carotid artery, left subclavian artery, esophagus, thoracic duct, left vagus nerve, left phrenic nerve, pulmonary trunk and thymus. Okay. Next, you can see the diagram here. So draw the lung. But remember, in the lung, when you draw, here there is a impression that is called as this notch, that is called as a cardiac notch. This is tongue-like projection, which is called as a lingula. So remember, cardiac notch you have to know because it is related to the heart. So here it is a cardiac notch. Next, you can make out. First is the artery you draw, that is called as the arch of aorta, which will continue further as the descending thoracic aorta. Then you see the branches of arch of aorta here, they call a left common carotid artery, left subclavian artery. These are the branches. Behind it you see trachea, then behind it you see the esophagus. So you see here there is a thoracic duct running on the esophagus. Then here the nerve called as a left recurrent laryngeal nerve. There is a left recurrent laryngeal nerve and one more is a nerve running here. It is called as a vagus nerve. These are the features you see in the left lung. So let me repeat you again. So the mediastinal surface of the left lung consists of arch of aorta, which will continue further as descending thoracic aorta. Then you see left common carotid artery, branches of arch of aorta, left common carotid artery, left subclavian artery, trachea, esophagus, thoracic duct. The nerve running in the trachea is called left recurrent laryngeal nerve, and one more is the nerve running is called as a phrenic nerve. Okay, and it is related to cardiac impression for the left ventricle. Okay. Okay. So then we look into the next. It is the hilar structures. Okay, these are the mediastinal surface of the left lung. Now, can you make out which side region you are looking here? Which lung is this? This is of left lung. How I know it is of left lung? One more point is, see, you can see one fissure here. That fissure is called as only one fissure is present. Oblique fissure. You can see the two lobes, superior lobe and inferior lobe. Okay. Next, impression is the RC, arch of aorta, descending thoracic aorta. You can see that is the impression for left common carotid artery, left subclavian artery, trachea, esophagus here. Okay, so these are the features. By seeing you can determine the which side the lung I am showing you. This is of the left lung. The fissure also you can see only one fissure is present, that is called oblique fissure, which will divide into two lobes, upper and the lower lobe. Okay. Then these are the, what you are looking here is a hilum of the right and the left lung. So see the hilum of the right lung, if you look here, it consists of the pulmonary vein, superior pulmonary vein, inferior pulmonary vein, then the artery called as a pulmonary artery, and bronchus, epiarterial bronchus, hyparterial bronchus. Okay, you can clearly see about the pulmonary two veins, superior and the inferior pulmonary artery, and the two bronchus here. Okay, next about the left lung, if you look, so in the left lung, it is the same. You see the two veins, superior pulmonary vein, inferior pulmonary vein, artery, pulmonary artery, and one bronchus will be present, that is called as a epiarterial bronchus, only one bronchus. Okay, so remember here two bronchus, here there is only one bronchus. So these are the difference between the hilum of the right and the left lung, hilum structures of the right and the left lung. Okay, see here structures at the hilum of the lung. Both lungs have pulmonary vein, pulmonary artery, and the bronchus. Right lung consists of epiarterial and the hyparterial bronchus, whereas the left lung consists of only one bronchus. See, epiarterial bronchus, pulmonary artery, hyparterial bronchus, pulmonary vein, pulmonary artery, principal bronchus, and pulmonary vein. So features are same, only the bronchus in right will be two, whereas in the left it consists of only one bronchus. Okay, then next you will see the bronchial tree, means what you know, the trachea. You know the trachea is dividing further into the two bronchus. This is trachea, it's dividing two bronchus, right and the left bronchus. We call it as principal bronchus. The principal bronchus will divide further forming lobar bronchus. Then comes the segmental bronchus that will divide further forming the terminal bronchiole. Next, till here it is a conducting system. Then comes the respiratory portion, the respiratory. Then it will divide further into forming the alveoli. So here you can see this is a lobar and this is the segment you are seeing. This is the respiratory part you are looking. They are all the alveoli where the gaseous exchanges takes place.